Hey, welcome back to Medicare Mondays. Today's session is being pre-recorded. Today's session is about Medicare and employer coverage. Several types of employer coverage. One would be job-based insurance, another would be retiree insurance, and another would be COBRA. Let's start with job-based insurances. This is insurance offered by an employer or union for coverage of employees. If you are covered by your or your spouse's, or in some cases your family members' job-based insurance, it may work with Medicare to cover your health care costs. Job-based insurances may also allow you to be able to delay into Medicare enrollment. Job-based insurances either pay primary or secondary to Medicare, depending on the size of the employer. Let's move on to retiree insurance. Retiree insurance plans that employers may provide to former employees who have retired. Retiree insurance always pays secondary to Medicare. And then we have COBRA. COBRA is the Consolidated Ombudsman Budget Reconciliation Act, for short, COBRA. It is a federal law passed in 1986, and it lets certain employees, their spouses, and their dependents keep group health care coverage for up to 36 months after they leave their job or lose coverage for certain other reasons, as long as they pay the full cost of the premium. The difference between primary and secondary payer for Medicare and employer coverage. Let's start with primary insurance. Primary insurance pays first for all your medical bills. The secondary insurance pays after your primary insurance. Usually, secondary insurance pays some or all the costs left after the primary insurance has paid, such as deductibles, co-pays, co-insurances. If your primary insurance denies coverage, secondary insurance may or may not pay some or part of the cost, depending on the insurance. If you do not have primary insurance, your secondary insurance may make little or no payment for your health care costs. Please note that if you are considering delaying into Medicare Part B enrollment because you have insurance, make sure you ask your benefits manager or human resource department how your insurance works with Medicare. In some cases, Medicare is primary to your current insurance. You should enroll into Part B to avoid any high costs that might be avoided. Medicare works with job-based insurance. If your job-based insurance is primary, you may wish to delay in Medicare enrollment because you already have primary coverage and can sign up for Medicare Part B later. In other words, this is called credible coverage. If your job-based insurance is secondary, you should enroll into Medicare Part B to avoid high costs for your care. If Medicare is supposed to be your primary coverage, your job-based coverage may provide little or no coverage if you're not enrolled into Part B. Enrolling into Medicare after you've delayed. You can use the Part B special enrollment period to enroll into Medicare later if you have had continuously covered by insurance from work, credible work coverage, not retiree coverage, or by Medicare Part B since becoming eligible for Medicare. You can use the SEP when you have that job-based insurance from current work or in the 8 months after losing that insurance. This does not include COBRA. You will need evidence of your employer or continuous coverage. Generally, Social Security will ask you to file a L564 form, request for employment. coverage. How Medicare works with retiree insurance and COBRA coverage. Retiree insurance is a health coverage an employer provides to former employees. Retiree coverage almost always pays second to Medicare. This means that you need to enroll into Medicare to be fully covered. If you have COBRA coverage, when you become Medicare eligible, COBRA usually ends the date you get Medicare. You should enroll into Part B right away. If you have Part A or Part B when you become eligible for COBRA, you must be still allowed to enroll into COBRA, and you should enroll in it or keep Part B. Medicare is the primary insurance and COBRA is the secondary insurance. Retiree insurance and COBRA do not entitle you to have an SEP to enroll into Part B. You may have to wait for coverage and possibly pay penalty. Let's look at a little chart that coordinates the different insurances of a job-based coverage. Sometimes we have individuals that are age 65 and older and that are still working. Here is an example of how Medicare or the employer coverage would pay. Then we have disabled with job-based insurances, and this is how they would pay. And then we have retiree coverage and COBRA coverage. Feel free to download this PowerPoint if you have any questions or want to have this chart. What is credible coverage? Credible drug coverage is on average as good as or better than the basic Part D benefits. You should receive a notice from your employer or plan around September of each month informing you that your drug coverage is credible. If you have not received this notice, contact your Human Resource Department, drug plan, or benefits manager. Several types of plans that offer credible drug coverage are including job-based insurance or retiree plans, Veterans Affairs benefits, TRICARE for life benefits, and federal employee health benefits. Don't forget to make sure you look at prescription drug coverage. That's one of the other required areas that Medicare wants you to sign up for, and if you don't, you may have a penalty at a later time. Some employers offer credible coverage for current or former employees. Ask your employer if yours is considered credible, as good as, or better than Medicare Part D. If so, you can delay enrolling into Medicare Part D without a late enrollment penalty. If your drug coverage isn't credible, or if you don't have prescription drug coverage, you should enroll into Part D as soon as you lose your credible work coverage. Medicare and health savings accounts. Health savings accounts are accounts for individuals with high deductible health plans. These include funds contributed to HSAs, and they are not taxed when put into the HSA or when taken out, as long as they are used to pay for qualified medical expenses. Your employer may oversee your HSA, or you may have an individual HSA that is overseen by a bank, a credit union, or an insurance company. If you have an HSA and will soon be eligible for Medicare, it is important to understand how enrolling into Medicare will affect your eligibility to contribute to an HSA. To qualify to put money into an HSA, you must be enrolled into a high deductible health plan and have no health coverage that does not have a high deductible health plan. This means the high deductible health plan members pay in full for health care services until they reach their deductible for that year. Afterwards, the coverage, a large percentage of the members' coverage for the remaining of the year. Medicare and health savings accounts continued. Because the tax rules governing HSAs do not allow contributions if a person has insurance coverage that is not an HDHP. If you enroll into Medicare Part A and or B, you can no longer contribute pre-tax dollars to that account. The month your Medicare begins, your account overseer should change your contribution to $0 per month. You may, however, continue to withdraw money from your HSA after you enroll into Medicare. Withdrawals are not taxed as long as they are used to pay for qualifying medical expenses, including deductibles, premiums, co-payments, and co-insurance. If you choose to delay into Medicare enrollment because you are still working and want to continue contributing to HSA, you must also wait to collect Social Security retirement benefits. This is because individuals who are collecting SSA benefits when they become eligible for Medicare are automatically enrolled into Medicare Part A. You cannot decline Part A while collecting Social Security benefits. Make sure to stop contributing to your HSA at least 6 months before you do, so your plan to enroll into Medicare. If you do not stop HSA contributions at least 6 months before Medicare enrollment, you may face tax consequences. Enrolling into Medicare after having delayed because of job-based insurance. You can enroll into Medicare Part B through the SEP, Special Enrollment Period. You will have 8 months for that special enrollment period. In most cases, you should enroll into Medicare immediately after losing your job-based insurances to avoid gaps in any kind of coverage. To enroll into Medicare Part B with the SEP, you will need the following forms from the Social Security Administration. You will need the CMS 40B, that is the Medicare Part B enrollment form, and then you will need the CMS L564 request for employment form. It is wise to bring both forms filled out to your local Social Security office. To find that local Social Security office, please visit www.ssa.gov, make an appointment. Retiree insurance and Part D. Some retiree insurance plans offer prescription drug coverage. If your retiree insurance offers credible drug coverage and you prefer it to Part D, you can delay into Part D without any penalties. Even if your retiree drug coverage is not credible, you may want to keep it if you have high drug costs. In some plans, you cannot drop drug coverage without losing your retiree health coverage or vice versa. Keep in mind that your spouse or dependents are not eligible to use Medicare coverage and may need other insurances if you drop that retiree plan. Part D is also required at the age of 65 unless you have that credible coverage. Remember to protect your Medicare number. Some things that you want to watch out for is never to give out your Medicare number to personal information to anyone other than your doctor, healthcare provider, or any other trusted representative. Always protect your Medicare number and card as you would a credit card. Never giving out your number to anyone who contacts you through unsolicited calls, text, or emails. Always be cautious if anybody who offers you free testings, treatment, medical supplies, or gifts. How you want to report this? You want to report potential medical identity theft if you gave out your Medicare number over the phone or internet to somebody offering free equipment, testing, screening, or back braces. You give out your Medicare number over the phone to somebody that said you need a new Medicare card, that it is plastic and it has a chip on it, or it is laminated. Medicare is not changing or updating their Medicare cards. You see charges on your Medicare statements for services or items you did not receive or need. You are contacted by a debt collection agency for a bill for services you didn't receive. You receive boxes of braces, test kits, or other medical supplies in the mail that you did not request. Get to contact if you have any questions about fraud, waste, and abuse on your Medicare. You could contact your employer coverage. You could contact your benefit coordinator. You can contact Social Security. You can also contact Medicare, or you can contact the State Health Insurance Program and the Senior Medicare Patrol. If you further help with Medicare, contact any one of our community partners listed here. We have Aging Well, Johnston Senior Center, West Bay Community Action, South Kingstown Senior Center, Westerly Senior Center, Rhode Island Aging and Disability Resource Center, East Bay Community Action, Leon Matthews Senior Center, Progresso Latino, Edward King House, and of course the Rhode Island SHIP and SMP line. Thank you for viewing our video. My name is Kim Timpson. I am the Health Insurance Coordinator for the state of Rhode Island, along with my colleague Jennifer Reeves, who is the SHIP and SMP Volunteer Coordinator. We hope you have a great day.